Hi, this is John Kanellopoulos from our center here in Athens, Greece, the Laser Vision Ambulatory Surgery Center. We have here a young gentleman who underwent in his left eye. He's 22 now. He had keratoconus. He underwent in his left eye corneal cross-linking in April of 2021. So we're October 22, so it was a year and a half ago. And if we look at the parameters of the two eyes, the right eye, which is clear, we saw the left eye there, has, we can see the cone here at stage 2 to 3 based on the Amsler-Krumai criteria. On the pentacam, the left eye is stage 2, although it seems very flattened in the center. We're almost tempted to think that he may have had laser done there, but this haze developed the last few months. We're in October, so we're 1 or 2 months after a southern Mediterranean summer, and we've reported on younger male patients. It was a teenage patient that developed 2 years after corneal cross-linking significant haze with significant UV exposure. So we speculate that this haze is caused by extreme exposure to UV light. The other thing of interest here is if we look at this young gentleman, we compare his epithelial maps. So this is the epithelial map with the OptoView Avanti device of the right eye, and we can see where the cone is. This is total cornea thickness. This is the epithelial map, and we can see the epithelial map, despite of the corneal cross-linking, is very thin over the cone area. Looking at the OCT thickness maps of total cornea, we can tell that there was probably no laser involved with his cross-linking in Cyprus, because there's no alteration of what we would expect to be a normal cornea thickness, normal is a dysnomer, of the usual cornea thickness in keratoconus eye. And we can see that the epithelium over the area with the haze is normal. So this tells us that our young gentleman is rubbing his eyes. Upon questioning, he does sleep face down on his right eye. So we have to protect this. We don't want the ectasia to reignite. So we're going to supply him with our YouTube video of do-it-yourself sleep mask, 2 soft sleep masks sewn on either side of a cornea, of a eye shield, in order to protect the eyes from eye rubbing during the sleep and not disturb, obviously, sleep, because this is quite comfortable for patients to wear. So in summary here, 2 major points. Late haze, we're going to treat this with topical corticosteroids for 6 months, probably from extensive UV exposure in Cyprus. Cyprus is even more south than us here in Athens, so more UV index. And the fact that despite corneal cross-linking, we have epithelial maps here that reveal active eye rubbing and the potential for the disease to progress despite the corneal cross-linking. We saw the topography maps before. He is 20, 25 plus, uncorrected in the right eye, and 20, 30 minus in the left eye. So we feel, I think that in my opinion, in the future, he may require some further correction for his right eye as he grows older. This significant astigmatism that's quite irregular may start to reduce his uncorrected visual acuity. We can see here 4.7 diopters of astigmatism, and it's remarkable that with this irregularity in the cornea, a keratoconic patient can see almost 25 plus, and we can almost conclude why, because right here we can see that he chooses his visual axis to be closer towards the cone and utilize the multifocality of the keratoconic cornea to his advantage. John Kanellopoulos signing out. Thanks so much for your attention.